Hi, my name is Alex Lahart, and I'm a neonatologist at St. Louis Children's Hospital. Welcome to LOGiC.baby's NICU 101 channel. Today, I'm going to go over some of the members of the medical team that might be helping care for your baby if they're admitted to the NICU. If your baby's admitted to the NICU, you may see a ton of people coming in and out of their room, and it can be really overwhelming and scary to figure out who all these people are. I'm hoping to clear up some of that confusion for you today. In the NICU, we really work together as a team, and all our team members have different but very important roles in looking after your baby. Now, every NICU might have a slightly different structure to their teams that are looking after babies, and that just depends on their staffing models and also if they're a teaching hospital or not. So let's start with the doctors. Every team is going to have an attending neonatologist or NICU doctor like me. As a neonatologist, I have completed medical school, completed my pediatric residency training, and completed a 3-year fellowship in neonatal perinatal medicine. We are experts in looking after babies that are born early or sick or with birth defects. We're also sometimes called the attending doctor, attending physician, or supervising doctor for your baby's team. Now, if you are at a teaching hospital, you may have other doctors that are involved in your baby's care. This could be the neonatology fellow who has completed medical school and pediatric residency training, but is now working on their neonatology subspecialty training. You may also have a pediatric resident who has completed medical school and is working on their pediatric training to become a pediatrician. Now, if your baby needs additional specialists like a pediatric surgeon or a heart specialist like a pediatric cardiologist, then these doctors will have similar teams that might also have attending doctors as well as fellows and residents. Occasionally, you'll even see medical students in the NICU that are involved in your baby's care. Another important team member is your neonatal nurse practitioner. A neonatal nurse practitioner is a nurse who worked for several years as a bedside nurse in the NICU and then went back to school and got a master's degree so that they're able to be a neonatal nurse practitioner. This means that they can administer and prescribe medications for your baby. They can also perform procedures and manage other aspects of your baby's medical care, all under the supervision of an attending physician. Now let's talk a little bit more about your bedside nurse. So the nurse that is assigned to your baby every day, so there'll be one for day shift and one for night shift, 24 hours a day, your baby will have a bedside nurse. This nurse is going to do the most hands-on care with your baby. This can be anything from administering medications and putting IVs in your baby to changing their diapers, feeding them, and sometimes even just holding your baby for comfort when you aren't able to be there. They are going to be the most important resource in teaching you what you can do for your baby while you're in the NICU together. There are a lot of other staff members who are involved in the care of your baby. Let's talk about a respiratory therapist. This is someone who's gone to school to specialize in the machines that we use to help your baby breathe. They're going to work very closely with your team of doctors and nurses to make sure that your baby's getting adequate breathing support using the different machines like ventilators and CPAP machines. There are several other types of therapists that might be involved in your baby's care in the NICU. These therapists all have master's degrees in their area of specialty and are often specialized to working with babies. We have physical and occupational therapists, or PTs and OTs as we like to call them, and they specialize in the comfort and positioning of your babies. They work on their muscle tone and movement and help them achieve new developmental milestones and skills. A speech therapist is also present in the NICU, though they don't actually have anything to do with speech for babies. These therapists are specialists in working on helping your baby learn how to eat. You may also see pharmacists and dietitians while you're in the NICU. The pharmacists in the NICU have often undergone specialty training in pediatrics or neonatology more specifically, and they will work with your medical team to make sure that we are using the right medications at the right doses and everything for your baby and their medical condition. The dietitians are experts in nutrition. They're going to make sure that your baby is getting the absolute best nutrition that they need to grow and develop. Now, I know that was a lot of information that I just gave you, and it can be really scary to think that your baby is going to need this many people to help look after them. Never be afraid to ask who is coming into your baby's room and what their role is in looking after your child. We are all here to help your little one get through their NICU journey and also to help you get through the NICU experience. Thanks for tuning in today.